Welcome everybody. Thank you very much for making time this afternoon to attend our webinar about blockchain technology in health and social care. My name is Chris Pett and I'm an enterprise expert at the University of Surrey's Set Squared Business Incubator, where I work with about 12 SMEs who have been founded in the last 3 years and who are on their journey from idea to go-to-market strategy, and through that to raising investment, securing grant funding, and entering the market with an exciting new product or service. Some of those businesses are already researching blockchain technology for their businesses. In fact, one of them is on the call today, and they're going to be speaking to you soon. I'll introduce the panel in a moment. Before I proceed, can I ask my colleague Caroline Fleming just to say a word of welcome to the attendees on behalf of Set Squared Surrey.
Thank you, Chris. Yes, hello everybody, and welcome to this webinar. Thank you all for joining, and I hope you find it really useful. We're using this webinar as a way to start engaging you all really with our Blockstart program. So this is a pan-European program, which Chris is going to talk more about. And it's both about supporting SMEs to understand blockchain technology better, but it's also about connecting the academic expertise that we have at Surrey in blockchain technologies with SMEs out in our local community and further afield in the rest of Europe. So this webinar hopefully will show you that we've got companies who've got needs, we've got academics who've got expertise, and we've got people like myself and my team who can facilitate joining everything together. So that's really what we're trying to demonstrate here. And please do ask questions throughout the event or add comments, and I'll try and keep a track of them and make sure people's voices are heard where they want to be. Thank you.
Thanks very much, Caroline. Okay, so let me just jump in with a short explanation of the agenda today. I'm going to explain a bit about the Blockstart program to you and why it's useful to SMEs. So I'll lead off with a short presentation about that. And then I'll hand over to Andrew Hudson from BetterTrack. Now, he's one of the businesses I mentioned who's a member of the Set Squared Surrey Incubator, and he's been making great strides during this year with an enormous amount of research and development work already in collecting data around social care, and he'll talk to you about that and about the potential application of blockchain technology to his product and business development. So that's going to be a case study from the perspective of an SME. That will lead on to a presentation from Jeff Taylor, who's a senior software engineer at Chainpoint in the Netherlands. And Jeff is going to speak about the technology solution development pathways that SMEs interested in blockchain might follow, and a little bit of background about the potential utility of blockchain technology in the area of healthcare. And then we're going to move on to Professor John Colomos, who's joined us from the University of Surrey. He leads the blockchain activity at Surrey, and he's going to be talking about the role of academic research and development collaboration for SMEs in bringing meaningful and effective products using blockchain technology to the market. And then we'll have some time for Q&As afterwards. So without further ado, I'll jump in and tell you a little bit more about the Blockstart program. So Blockstart is an initiative that's funded by the European Regional Development Fund, specifically through their Interreg organization, which covers Northwest Europe. And you can see on the map here the project area. So broadly speaking, we're talking about northern France, northwest Germany, Benelux countries, and the east rather of the UK, but extending potentially across the whole of the UK as far as membership of the Blockstart program is concerned. So it's a transnational innovation ecosystem. Those very important words, all three together. It's transnational because we're actively collaborating across borders between all of the partners, and we've already got a great spirit in the program going among the partners, and we're just about to launch this training program. It's all about innovation, so we're helping businesses, small businesses, to innovate with data in the context of providing services in logistics, agro-food, which is a term which broadly speaking means farm to fork, and health and social care, specifically health services. So we're connecting blockchain solution providers like Chainpoint, academic researchers like the University of Surrey, and technical and business support experts like myself, and the SMEs who are active in the sector, such as BetterTrack, as end users. And if you're an SME anywhere in this region, or you know an SME who would benefit from this program, then please put them in touch with us. Please get in touch with us yourselves directly if you're active in any one of those sector areas. The program is free, but it's very well funded, so there's a great deal of value in the support that SMEs will receive. One of the points of this meeting today, though, is not just to speak to the SMEs and sort of advertise or pitch the value of the program to those SMEs, but it's also to speak to those people who we know are on the call from our partners in the Blockstart program and from other associated organizations, to spread the word as widely as you can that there is this amazing resource that's going to be very valuable for the SMEs who are directly participating, but is also going to have enormous value to their partner organizations, for example, academic organizations or solution development experts who are already engaging with those SMEs, who might want to introduce the SMEs to this program, and through that add value to the ecosystem of data, support and services that you're already a part of. So please do have that in mind, and we'll give you some information at the end of this webinar about how you can get in contact with us to take those conversations further. So these are the organizations who are involved from across the Northwest European region. University of Surrey covers the UK area, obviously. We have 3 organizations in the Netherlands, also companies in Paris, companies based near Frankfurt, and also in Belgium as well. One of the functions of the Blockstart program, and this is the initial phase of the program, which is starting at the beginning of next month, it's launching on the 2nd of December, and is going to last all the way through 2021, is to provide a free training program. I'll come on in a moment to why we think that's an essential ingredient of this support process for SMEs. But just to tell you now that this is the context of this meeting today, is to explain the value of this training program to SMEs. So it's free. The idea is that regardless of your level of technical expertise or competence in the area of blockchain technology, as the founder or senior member of staff of an SME, you will be able to join this training program and go from not really understanding, but perhaps having an inkling of the value of blockchain to your business, your products and services, to, at the end of it, having a clear path forward, both in business terms and in technical terms, about how you can integrate blockchain technology into your products and services in the next phase of your business growth and business development. It's not too hard for a very large organization to do that in terms of being able to afford consulting services, perhaps internal innovation incubators to explore this technology, but it's very difficult for SMEs to do that. And the Blockstart program is here to provide that service for you. And it's a tailored program. So rather than having a fixed syllabus of teaching and learning workshops and so on that every business needs to go through, what we do is we first get to know the SME, get to know their existing business, their current range of customers, their strategy for development and growth, and then we will tailor the support program to your needs in terms of which training opportunities from across all our partners would be most applicable to what you need to learn and what you want to develop. So it's a very hands-on process, and I think that's going to increase the value to the SMEs enormously. And what that means is that regardless of which country you're from, you can access training opportunities across all of the partners anywhere in Northwest Europe. Originally, when the program was first developed, we assumed that that would also include a great deal of travel for SMEs between those delivery points and potentially of experts to your location, wherever an SME is based. But obviously, in the context of COVID-19, we have switched to an all online training program for now, and we'll review that at the early part of next year to see if we're able to recommence any on-site training. But we think this is likely to be online only for the foreseeable future. So we've retooled all of the training courses with that in mind. Why blockchain for SMEs? Well, I think that, as I touched on a moment ago, it's not too difficult if you're a larger organization to use your internal resources and the slack you have in the system, perhaps, to investigate the potential efficacy and business value of blockchain. It's much harder to do that when you're an SME, and as myself, having worked in SMEs all my career, knows very well that you're always up against it in terms of resources, in terms of time, and in terms of money that you can spend on anything. So there's always an appreciable cost to investigating any new technology. the idea of the Blockstart program is we're going to take that pain away for you by giving you that tailored support that you wouldn't be able to afford or make time for acquiring for yourselves. So I think the important thing to bear in mind is that blockchain is potentially of great value, but it's hard to grasp. It's very difficult for businesses, in my experience, to explain quickly to a potential customer why they're looking at blockchain as part or all of the solution they're going to provide. So it's hard to grasp, it's hard to explain, but it is important to investigate. This is potentially transformative technology that might, in certain areas, I wouldn't say broadly across all of our economy or society, but in certain specific areas, including these vertical sectors, has a potentially transformative impact in the years ahead during this decade. And if SMEs are unable to grasp that, then it's going to be very difficult for them to keep pace with or potentially to exceed the rate of growth of more established businesses. So it's hard to grasp, important to investigate, and Blockstart is here to make that easy. This is what the journey looks like for a business that's going to be engaging with the Blockstart program. We're going to start with business training, and this might be as simple as helping an SME to really shore up and improve the strategy around where they think growth is going to come from in their business in general. And then we'll go from that general business development training into more specific application of blockchain technology to that growth strategy. Then we move into the blockchain basics part of the training program. And these two parts, the business training, the blockchain basics part training, are really what encompasses the main part of the training program through 2021. And that's going to give you an understanding, sort of cocktail party level ability to explain the value of blockchain to a potential customer. Then you move into the advanced part of the training, which segues into solution development. And this is where Chainpoint and other partners come in to the process, where you actually start doing some discovery, some alpha and beta development work around potential blockchain solutions, hopefully in concert with some of your customers, so that you're actually developing services that can be tested at pilot scale and leading to a proof of concept. And you see my point of the POC stage here. And then that moves on to potentially, for some of the blockchain startups, funded blockchain technical development work, which would produce a product or service that's ready to market and commercialization at the end of the process. Not all the businesses who receive the training will get to that point. We don't expect all of them to feel that that's appropriate. But for some of the businesses, that will be the point where you're actually able to commercialize blockchain technology entirely supported by the Blockstart program from start to finish. So that's the blockchain program. And hopefully that's given you a flavor of what we're all about. And if you've got some questions about that, please do ask them now or later. But I'd like to pass on to my colleague now, Andrew Hudson, who's going to talk to you about why blockchain, what's the significance of this technology potentially for a company like BetterTrack. Andrew, over to you.
Thanks very much, Chris. And just following on from your presentation and the point about blockchain being hard to grasp, the purpose of this presentation is really to share with you some of the challenges we found in the social care sector in terms of managing performance data particularly. One of the things we'd like to sort of share with you is sort of different practices and models that we've been looking at. So by way of background, I've worked in sort of more corporate sector and government, sort of large organizations for something like 25 years with a background in strategy and change management. And one of the things I realized was that at the heart of everything was really performance measurement as a core discipline and practice. And about 20 years ago, I started a business which was selling a platform to large corporates. But I moved about 2 years ago to set up BetterTrack, focusing on small businesses and the social care sector. So this presentation is really a sort of a presentation of our latest thinking about architectures for measuring performance. And if we look at the social care sector, particularly, I think all countries have struggled terribly with the COVID crisis. And the UK alone, something like 23,000 excess deaths have been reported in care homes due to COVID. And a recent study identified potentially another 10,000 more deaths than were previously thought. And one of the things with this is that the cause of deaths is still not yet very clear. It's unclear whether those people catching COVID or whether it's people who've, dare I say, given up the will to live because they're not able to see their families. So no one really knows what's actually happening in care homes particularly. And there's very little data about what's happening in home care, which is where you have nurses and carers going into people's homes. So there's very little information on that. So the background to this really, back in April, I was listening to the daily briefings and getting increasingly frustrated by the lack of data. I'd just been working for 2 years with a social care provider, so got first-hand experience of the complexity of managing and measuring performance in that sector. And in fact, of all the organizations I've ever worked with, anything from Ford worldwide, this was by far the most complex type of business I've ever worked with. So it's a huge problem, and I can see why so many social care providers struggle. To give you an example of that, one of the things social care providers have struggled with is the huge diversity of different types of data. And one of the barriers that regional, local, and national stakeholders have found is that without the data, it's very difficult to tell where the problems are. So lack of PPE equipment, how many carers are sick at any point in time, could some local effort be put in to help out some of the providers? And just to give you an idea of the scale, there's something like 18,000 providers nationally. There are another 300 commissioning units who fund the care. There are general practitioners, so that's doctors and the hospital trusts, pharmacies, suppliers, something like 1.5 million carers nationally. So it's a very large and complex area. And unfortunately, most of the sort of reporting which is done relies on crude spreadsheets. And it seems that every single person who wants to request data has their own format. So it's completely unstructured, and hence why there's such a gap in data available. One of the things that research units and academics have been looking at is trying to get more insights about how things are performing. The only kind of real national survey that's done is looking at the outcomes for the service users, so that's the residents of care homes. So that's an annual survey that goes out through the local authorities to individual clients. And something like 6 months after year end, there are some results which are shared, which for most of the providers is almost sort of meaningless, really. It gives some general statistics so that as a country we can compare ourselves with others, but nothing that actually helps in terms of the day-to-day management of care. So one of the things I realized was that the focus of all efforts around performance measurement really has to go back to the coalface, to the social care providers, and helping the managers and the staff to better measure and manage their own performance. And once that data is available, then it can be shared more in a better way with all the different stakeholders, and moving away from these spreadsheets. So something like 20,000 spreadsheets a month get circulated. One of the things we found, someone made an error when typing into these spreadsheets. They said they'd had 26 safeguarding events. A safeguarding event is something which is a significant safety event, and that gets reported potentially to police, commissioners. So the fact that no one actually even picked it up just implies that no one's actually even looking at the data. So with all these spreadsheets going out and no one using it, and with such a crisis in the care sector at the moment, it kind of makes you think there ought to be a better way of doing it. One of the challenges in social care is that there are hundreds of different performance indicators. I'm showing you here a sort of way we've looked at it to try and put some structure. So starting with the end in mind, on the right-hand side, you've got the user outcomes. So that's the residents of care homes. How do they experience care? Is care safe? So those sorts of questions. You also have the Care Quality Commission, the regulator, that has responsibility to oversee the provision of care through the providers and ensure that it is safe and effective. And so on an annual basis, typically, they will go and do an audit. So the Care Quality Commission have their own questions and studies which they do. But if we look at the cause and effect, looking at what providers then need to do to deliver safe care, the first thing is really clinical effectiveness. So how well do the carers actually provide the care, administer the medications, and provide and deliver the care plans? And there's also the operational effectiveness, which is how the staff actually manage and coordinate the carers to attend shifts in people's homes or at each of the care homes. And as we work back, you can look at then to enable that, you need the right staff and teams in place to deliver care safely. You need to have effective practices around governance and safety. And as a care provider, there's a financial concern as well to make sure that you've got enough funds to cover costs of payroll, and also that you've got enough referrals coming in to ensure that as a provider, you've got enough clients to actually support and provide care to each of these and look at different performance indicators. A good example being leadership and communications. I haven't seen any examples of the types of indicators that are used to measure leadership performance. It's something that a lot of corporations do, but the quality of leadership in many care homes is somewhat lacking and could be an area to be looked at. Certainly in acute hospital trusts, there was quite an effort a few years ago to look at leadership of acute hospitals, and this could be something that could be done there too. So looking at some of the challenges in measurement and just taking governance and safety, for example, we've got quite a significant variation of different types, but also the carers themselves who might complain about the clients that they're providing care to. Concerns, you have now COVID-related incidents, grievances. So there's a whole range of different types which are quite difficult and have to be handled in different ways, including information governance events where potentially care plans have been shared with the wrong people. And then to sort of look at the structure of the categories, the severity of incidents, and organizing them into sort of common themes. It's very challenging actually when you've got such a diverse range of different types of incidents to put them into any logical structure. And if we're looking to get insights on these, not just from one provider, but looking across multiple providers, there needs to be a clear structure and common standards around this. Otherwise, there's very little chance that researchers, local, regional, and national teams could actually get insights on it. And another aspect to consider is that when an incident is recorded, it doesn't actually mean that it's been substantiated or not. And one of the concerns providers have is that if they start sharing high levels of incident rates, that could compromise the number of referrals they get from funders. And in fact, many of the incidents need to be properly qualified before they actually report on them back to the Care Quality Commission and to other stakeholders. And it's important that we really kind of get to understand how this data's provided so we can organize it into with clear statistics about the trends. So that's some of the help we're looking for actually around the types of indicators that should be used with the care providers. And so the problem we have at the moment is if we're looking at the range of different types of data that we need to support, where in the center here, we've got the social care provider, and there are circa 18,000 of them nationally. On the right-hand side, you've got the regulators, the regions and the funders, each of whom are separate entities. And on the left-hand side, there's a need for national structures, classifications, libraries of indicators and benchmarks, and potentially surveys that could be made available to each of the providers so they've got some common way of working. And many of the providers are also moving towards a kind of digital platform adoption. So having standard integrations into a central model would very much help to then start supporting sort of performance measurement within the provider. So the challenge we have is, do we go for a model whereby each provider distributes or shares the data to each entity? Or do we go to a model where there's one master data set that everyone has access to? So the provider basically submits data to that. And therein lies the challenge really, is whether a distributed ledger or blockchain, what role would it have to enable data sharing whilst addressing the needs for security, data protection and use of data on a need-to-know basis across all these stakeholders? And we're currently looking at options for research on this. So looking for any support that you might be able to lend. So I'll just hand back now to see if there's any questions.
Thank you, Andrew. If you have some questions for Andrew, we will store those up and then share them out at the end, and we'll try and cover everything. Thank you very much. But if I can move on to Jeff Taylor now. Jeff is a senior software engineer at Chainpoint in the Netherlands, and he's going to talk about, okay, you've got a technical challenge like Andrew's. What approaches might a business take to use blockchain to try and solve an issue like this, and what role might a solution development partner like Chainpoint play in that process? Jeff.
Thanks for having me on board, everyone. Quick introduction. So I'm Jeff Taylor. I work at Chainpoint in the Netherlands. So what Chainpoint does, very, very quickly, we focus on technology that brings elements of data that's normally scattered across things like supply chains. We focus on bringing all of that information together so that it can be viewed and managed more holistically. So one of the things that Andrew mentioned, which sounds very familiar to me, is this idea of just thousands of Excel sheets being mailed between different organizations and stakeholders, often with different formats. It makes it really hard to take that crucial step of transforming data into information. I've often said, data alone is not what we're after. It's information that we're after. We're after converting data into valuable information. And that's what Chainpoint focuses on by allowing supply chains to be more integrated with their data. That being said, I'd like to focus today on a few aspects of blockchain. So there are many things I could talk about, but I think these three key pillars that I've got showing on the screen at the moment are particularly relevant in situations where, as organizations, we're increasingly faced with challenges of sharing information among various stakeholders, but we've got to do that securely. And we want to ensure that data has strong integrity and that data is correct as well. So I think these three pillars that I've got here align quite well with those sort of challenges. In a moment, I'll focus on a small healthcare use case, which I admit is a bit sort of theoretical, but I think it kind of shows quite well how blockchain can begin to make a difference and how it might be utilized. I must say it's maybe a bit ambitious what I'm showing, but I think it does sort of cover quite a lot of the aspects I want to talk about. So I'll show that in a moment as well. None of this will be too technical, by the way. Anybody should be able to follow this today. So, key pillars of blockchain: digital, distributed, trustworthy. Let's just zoom in on that a little bit. So it's maybe a bit self-explanatory, isn't it, to say that blockchain is digital? But the funny thing is, in our daily business at Chainpoint, when we're talking to supply chains of all types of flavors, that could be clothing, it could be mining, it could be healthcare, doesn't really matter. It surprises us just how much information we see, which is not very digital, to be honest. It's either on paper or at best it's on things like Andrew mentioned, like Excel sheets. So one of the things about being digital at all is a focus on less manual documentation, which means that it can't get lost so easily, it doesn't get destroyed so easily. And moving on to that, it means it's also easier to preserve that sort of data. Once again, paper can get easily lost or destroyed. When information is digital, it can be backed up, it can be distributed across different geographical locations to make sure that that data can't so easily be destroyed, which is also great in terms of data integrity. When information or data is digital, I mean, this is the big one, it becomes computable. You can do things with it. You can rapidly validate that data and you can perform automated steps on that data. So you can carry out all kinds of workflows. So one of the things that's quite typical at Chainpoint, for example, is the idea that information from a certain stakeholder somewhere in a supply chain could add some information, and that could trigger certain events in a digital system to pass certain information onto somebody else in the supply chain, maybe a warning that their delivery is going to be late or something like that. So automation is a really big thing, and it's pretty hard to automate when things are written on paper, to be honest. So it's quite a big thing. The other thing about data being digital is it makes it highly discoverable. It makes it very, very searchable. So these are some of the advantages, which again, maybe they're self-explanatory, but you shouldn't underestimate them either. These are really, really important things when you start digitizing information, and blockchain lends itself well to these kinds of scenarios. The next key pillar Zooming in a little bit more now, I would say, on more the world of blockchain and why it's a bit of a game changer, actually. Blockchain is a distributed data system. So basically, what that means is multiple stakeholders or organizations that collaborate in some way, they work together, they've got access to their own independent set, if you like, of the same data. And that's the real game changer here. They can have their own sort of copies of the same equal set of data that everybody else is on. And that makes it really quite interesting because it opens up the idea that organizations can be much more transparent towards each other because they're on that same set of data. Now, when information becomes a lot more transparent because it's accessible to multiple organizations, it becomes a more collaborative process. It lends itself well to organizations that are on that same set of data, being able, like I said, to automate certain processes between each other, to share the same set of data. And blockchain really lends itself very, very well to these sort of situations where the data is replicated among partners that work together, which can make it quite cost efficient. So think of things like digitized shipping documents that can be sent in an instance from a carrier to a port, for example, and those documents could be automatically vetted ahead of time before certain cargo arrives, for example. Those kinds of optimizations just make a lot of operations a lot more efficient, and that's because it's collaborative as well. These things, you know, they all tie in together. It's not that one of these things is sort of like uniquely adding value. It's the whole mix of things coming together that really makes blockchain quite interesting. Also, one facet of blockchain is because it's distributed, because you've got these multiple copies of data, it becomes more verifiable. So we have a name for that in the blockchain world. We call that consensus. Now, I won't go too much into the technical details of that right now, but I suppose a good summary of what I mean with consensus is it's not just one single authority or party which is deciding correctness of information or data on the blockchain. It's not just one party that can influence and decide what correctness is, which is really good for integrity of data as well. Which leads us on to the next facet of blockchain, which I think is also very, very interesting, which is it's quite trustworthy. The blockchain is delivering quite a trustworthy way of transacting data with each other. So I'm going to focus a little bit more on this. A blockchain is auditable. So what I mean by that is when data is registered in a blockchain, the blockchain keeps appending data onto itself. So think of it a bit like your bank statement. If there was a mistake on your bank account, you could see that on your bank statement. What you can't do, you can't go back in time and just undo that transaction that took place. What you could do is have your bank statement or your bank account corrected by adding a new transaction later on that would compensate that mistake. There's a difference between the two things. There's a real difference. You see, what you're not able to do is go back in time and cover up that mistake. That's really, really important. That's what makes it quite auditable. And that ties in with the whole idea of where we say the blockchain is immutable, which basically means you, literally what I just said, you can't go back in time and cover up things that have already happened. You can't go back in time and change things, but you can go forward in time and make corrections. It's because it's immutable that it's auditable. Data on a blockchain is typically encrypted. Suffice to say, just at this level of describing things, that means that it's pretty good at shielding data from prying eyes, basically. And because it's encrypted, it makes it all the harder to uncover information that you shouldn't really be seeing. Now, when you start adding all of those things up together, I'm saying here that it's tamper-proof. I suppose what I really mean is it goes a long way towards being tamper-proof. It's the idea that data is immutable, that you need consensus, that not one single party judges exactly the correctness of the data, plus the fact that you've got encryption on the blockchain. When you start adding all these things into the mix, it goes a long way towards making blockchain a lot more trustworthy than some of the mechanisms we've been using in IT for a long time. What I quickly wanted to do here I won't focus on this too long, but this is a theoretical use case that I've made, which actually is quite realistic for me. Every now and then I have to do a blood test in the Netherlands. And the way that works is I make an online appointment, do that through my web browser, and I get an email back with a confirmation that that's done. And I do that with my local clinic. They've got a web application where I can do that. Okay, a few days later, I go to my local clinic, just in the area, and I get a blood test done. And what they do at the clinic, they ask me to bring some physical ID along to check that I really am Jeff Taylor. What happens then, I suspect, is that when the blood test is made, that blood is transported to a lab, it gets tested, but I expect there's some accompanying information, which I think is probably digitally transferred to the lab. What you also have at the same time, because in the Netherlands, we don't really work on this same model as the NHS, everything runs on insurance here for the health system. So the local clinic will make a claim to the health insurer. So will the lab. The lab will send results back to my local clinic, and they'll also send them into my national health portal, which I can securely log into in a web browser, and I can see my results. The take home here, what I want to focus is not so much on what happens with my blood test really, but what happens with the information, because these sort of orange or pink colored lines that I've drawn show sort of, okay, maybe it's a bit theoretical, but where information is probably crossing boundaries between IT systems. And that becomes really quite interesting, because what you're looking at here is IT in place to solve one holistic problem, giving me my blood test results, but it's crossing boundaries between different IT systems. How do we know what the levels of security are in all these different IT systems? Are they all the same? Are some of these organizations better at security than others? For example, what are the total costs of running all this? What happens if a system gets upgraded by the insurance company and all of a sudden the lab can't send their insurance information? It's not very harmonious. What if all these players were on one blockchain, as I call it, one system of record, where everybody is able to still operate as they do, but everything is being collaboratively stored on the blockchain under one system of record, where they have selective access to certain bits of data. It doesn't mean that it's a free for all where every organization can absolutely read each other's data. So we're talking about a form of transparency, but it's all integrated in one system, which means, in my opinion, it's probably way easier to control things like protocols, compliance, security aspects. It's probably more efficient in terms of costs and data transfer as well. So very quickly, last slide from me. That was one example of where I think blockchain could theoretically add value. That's the kind of thing we're talking about. Chainpoint is working together with Multitail in Blockstart to work together with SMEs to talk about their challenges. What challenges do you have? What opportunities do you see together with us to leverage blockchain to really, make a difference? It's what Chris was telling us about earlier. What we want to do is mix together SMEs with skilled business developers, skilled solution developers, like the software guys like myself, and we want to meld all that together in one pot, which I suppose will function with quite a sort of startup mentality, to be honest, of really being innovative, looking at the business opportunities, looking at the added value we can create, and for a few select SMEs going forward to really hammer out some really game-changing solutions that will really make a difference. That's the dream. That's what we're aiming towards, to create really good new business opportunities. So that was it from me. Right, there we go.
Thanks very much,
Excellent.
Jeff. Thanks very much, Jeff. That was an excellent presentation, very clear. I'd like to introduce John Colomos now from the University of Surrey.
Hello, everybody. Very pleased to be here on this webinar to introduce to you not only our centre, which was just launched last month, Decade, but also tell you a little bit about one of the research projects we've been running at the University of Surrey, exploring the intersection of blockchain and healthcare. So at the University of Surrey, we have quite a large number of blockchain projects at the research POC stage. we really focus on blockchain for the public good. So what that means is looking at applications of blockchain beyond cryptocurrency, which is where the story started, at other application areas, things like digital preservation, healthcare, identity, and so on. And this isn't because we have anything particularly against cryptocurrency. We use that in our projects. It's just that we feel that the additionality that UK research can bring beyond, say, the financial sector that's already investing heavily in this area is exploring alternative applications to this technology. So that's where our focus is. Okay, well, Chris mentioned, yes, that we have this new research centre we've just launched, Decade, which is a centre for the decentralised digital economy. Decade is an investment by the UK government through the EPSRC of about £4 million that has been backed up by further leveraged investment from industry of a further £6 million. And it will run for 5 years. And the focus of Decade is on this thing we call a decentralised digital economy. So basically, we recognise that we now all live in a decentralised digital economy in which everyone can be a producer and a consumer of goods and services. What I mean by that is, I could take an Uber or I could drive an Uber. I could rent out my apartment on Airbnb or I could go stay in an apartment. But all of these dynamic kind of peer-to-peer gig economy engagements are all underpinned by these centralised digital platforms. And actually, users rarely have a say in the governance decisions of those platforms. They're often made in isolation of the global impacts they have on society. And really what Decade is exploring is how emerging technologies like distributed ledger technology or blockchain, as well as AI, these sort of decentralized data technologies, could transform our digital economy through new kinds of decentralized platform on which these engagements could take place, and exploring the kinds of added value that would give, new business models around data, perhaps new, more inclusive digital economy, new forms of governance structure, that kind of thing. So we're quite multidisciplinary. We're more than just a technology research centre. Okay, so I'm just going to briefly touch on this. I mean, what is blockchain then? Okay, we've had some good introductions already today, so I will just skim over this. I mean, you can think of blockchain, or if we want to call it distributed ledger technologies, as being a way of storing data. So you can think of it as being a kind of database, but it's a database that has unique properties. First of all, it can guarantee the provenance of data within it. In other words, tamper-proof data. But uniquely, this guarantee over the integrity and provenance of the data stored can be made without relying upon a centralized authority. So the first use case for this was Bitcoin. Over 10 years ago now, we had Bitcoin proposed, where effectively we have a database that stores ownership of digital tokens, which are these virtual coins. And we want to basically track who owns which tokens without relying on a central authority like a central bank. And this is what blockchain is sort of named for the particular instance of distributed ledger technology used in Bitcoin, but more generally, it's what distributed ledger technologies are good for. It's basically getting a bunch of independent organizations or entities that don't necessarily trust one another, might even act adversarially towards one another, but they all have a mutual interest in creating a trusted store of data, decentralized store of data. And that you can see is evident in this Bitcoin use case, and it's evident in many other use cases beyond cryptocurrency as well. Well, so how does this work? I'm not going to do a deep dive on this, but basically we have a number of different ways of ensuring this integrity. And these are called consensus mechanisms. And this was touched on by somebody else earlier. Basically, you can think of blockchain as being a collection of these data blocks, which are these green blobs here, and they are linked together. So basically the latest block, which is here on the right-hand side, it contains some data, but it also contains a fingerprint, what we call a hash, of the previous block in the chain. And that in turn has some data, which contains a fingerprint of the previous block to it in the chain, and all the way back to the first block. And this gives the chain of data, this blockchain, integrity, because if we go edit, and manipulate adversarially some block in the middle of the chain, we would have to go and recompute all of these hashes in order to update the chain to have integrity so that these digital signatures match all the way along. And it turns out that it's actually quite difficult to do this because we have this thing also in the block called nonce. And what this means is it's basically just a dummy value, just a number, okay? But we choose that number so that the hash, the fingerprint, exhibits a characteristic pattern. And it's very, very hard to choose a nonce such that the hash of the entire block, the fingerprint of the entire block, exhibits this characteristic pattern. And this process of finding this nonce is what we call mining. And basically, when we want to add a new block, append a new block onto the blockchain, we need to find the nonce through this exhaustive search that takes a lot of computational power by people all around the world in order to make that block valid on the chain. This is what gives this particular kind of blockchain its integrity, the challenge, the difficulty of mining that new block. Because if it were easy, then we could just, as I say, manipulate a block in the chain and recompute everything straight away, all these fingerprints. But actually, because it's very difficult, it takes about 10 minutes for anyone in the world to find the next block, the next nonce. It would take so long to recompute the whole chain if we manipulated it, that by the time we'd done that, somebody would have just added on next block somewhere else around the world. And the rule is the longest chain wins. So this is basically how blockchain works. So this type of chain is called a proof of work scheme. And the disadvantage of a proof of work scheme is this computational expense, right? It's actually very slow to add a block. As I say, it takes in Bitcoin about 10 minutes to add a new block onto the chain. And that means it's a high latency system. It doesn't have a high write throughput to this system, okay? We can read it very quickly, but if we want to add new data, very slow. It's also very expensive in terms of energy, which causes it to then be challenging in terms of arguing for its sustainability. It lacks scalability. But its big plus is it's what we call an unpermissioned system. Anyone can write so long as they can mine the next block. And of course, anyone can read it. As it was said earlier, transparency of data on the chain is an important property as well. There's a different kind of consensus mechanism that we call proof of authority that actually turns out to be a lot more kind of popular and I'd say prevalent in terms of deployments of distributed ledgers at scale. It's what we call permission chain because it's slightly different in that although anyone can read the data in the blockchain, only a closed set of people on the chain, we call nodes, can write to it. We call that a click. And basically, the idea is that when a new block goes onto the chain, the writers, the people on the chain that have this special permission to write, have to sign off on that block. And if enough people sign off on the block, it becomes the next valid block on the chain. So this is actually very fast because it's kind of trivially, simple in computational terms to sign a block. You can get throughputs in the order of 1,000 writes a second, 10,000 writes a second. Compare that to the proof of work statistics I just gave you, one block every 10 minutes for Bitcoin. But you have this limitation that only a closed set of people can actually write. But it also, because it's computationally light, it has negligible energy footprint. So people sometimes refer this, Microsoft like to call it the green blockchain. And just a quick note before I go on into our use case, that a blockchain or distributed ledger allows you to store more than just data. You can also store programs on a blockchain as well. We call these smart contracts because they were first used in the context of financial use cases. So basically a smart contract is like a program which is also immutable, can't be changed on the blockchain, and it executes autonomously in this decentralized framework. So when particular events happen, this program will take particular actions like pay someone, for example, and because it's like immutably encoded onto the blockchain, it's kind of an autonomous agent that takes actions in response to certain events that you don't have to rely on a centralized entity, for example, like a bank, to execute those transactions. So that's what a smart contract is. Okay, moving on to our healthcare use case and bringing these ideas together to show how they fit together in this use case. I'm going to talk to you about fitness bands. I don't know how many of you have one of these on. I don't actually. As you can see, maybe I should have worn it. But basically, they're very popular. If we look at the statistics, there's actually just under 1 billion of these connected devices projected to be in use in 2021. I think it's about 800 million at the moment. And just projections for next year in terms of sales, we're kind of adding on 100 million to that in terms of smartwatches, another 500 million, 50 million for wristbands and so on. So what we were interested in this project was basically how we can use this wearable data to improve preventative healthcare and allow people greater agency and ability to commodify actually their own personal wearable data. So what do these fitness bands do? They typically have a bunch of sensors in them, things like accelerometers, heart rate sensors, galvanic skin response sensors, these sorts of things. It won't surprise you to know that there's already a market for the data that comes off these wearable devices. So if I were to, for example, go buy a Fitbit, and really I could name any of these providers of these devices, the business model that you kind of are subscribing to by purchasing that device is you wear the device, the device sends the data to some cloud server operated by that provider. And then based on the end user agreement you happily signed when you signed up to this device, they will then go and exploit that data. And in some cases, they will sell it on to people. And you don't really get control over who gets to use that data or what they use it for. So this is what we consider to be first generation model for this data. And what our project called Come Here was looking at was a sort of, we thought was a second generation kind of version of this ecosystem where you as an end user, have your wearable device. There's a healthcare provider, AXA were a partner on this project. So let's say they're AXA at the other end, and AXA might be interested in, I don't know, let's say 2,000 people's diabetes data. Okay. So they would then enter a request into the system, which is actually a bunch of smart contracts in blockchain. And the system would then broker access to certain signals derived from people's wearable healthcare data to AXA in return for micropayments to that user. So basically the user, as they are wearing their device, various AI algorithms are being run over that raw data to extract different signals with respect to, I don't know, stress and anxiety, diabetes, a bunch of other things. These signals are encrypted and stored, and then basically access to those signals is brokered to healthcare providers in return for micropayments that are made to the user. And the user then has agency over not only what data they share, what facets of their data they share, maybe their diabetes, but not their depression status, for example, that they also get the ability to commodify their data, receive payment for their data, and the ability to opt out and choose who gets their data. So this is this sort of vision that we put forward and built a prototype of in Come Here. So what's important to note in the Come Here project, and I think it's important to note generally, is that with blockchain, it's rarely a good idea to store personal information, such as medical information, on a distributed ledger. What tends to be a more common design pattern is that you would store that data somewhere like in a data lake in the cloud and store hashes, fingerprints of that data onto the distributed ledger. And thereby the distributed ledger, which is immutable, underwrites the integrity and the provenance of that data, but it doesn't actually store the data. Now, this is important because, well, first of all, there's technical scalability challenges of a distributed ledger. You wouldn't really want to use it as a mass storage medium anyway. But secondly, nothing that you put on a ledger can ever be deleted. And, even if you encrypt that data, at some point in the future, a decade later, someone will be cracking that encryption, right? And basically, you can't take back what you've committed to a chain. It's like an append-only data structure. So this is the model that we use. We basically have the user committing their data to what we call an aggregator. And this aggregating entity, which in this case was BioBeats, which is a partner on our project, they're running machine learning algorithms on that data, AI algorithms, which extract signals, and they store those signals in a data lake in their cloud. And then basically they're storing hashes of that data onto the distributed ledger in order to underwrite the integrity of their cloud, to prove, if you like, to the end purchaser of this data that it has integrity and provenance, and thus it has value. And then we have this smart contract system I mentioned previously, where a healthcare provider, for example, AXA, might issue a request into the system. They request so many, diabetes descriptors. That is then brokered in terms of a request going to the user. It flashes up on their device. AXA will pay you 10 cents a day for your diabetes data. Do you accept? You accept. And then a contract is entered into, and decryption keys to that data are issued to AXA, which then can approach BioBeats in order to download the relevant data they've been granted access to. And you can imagine also like a secondary market where there are multiple aggregators in this ecosystem, each of which might have different ML algorithms for extracting different kinds of signals. And maybe, preference starts emerging for certain persons' aggregation services because they're using a great machine learning model, maybe from the University of Surrey, maybe from someone else. This is like a kind of secondary market we see that might exist in this space. Like, we built a prototype of this system and trialed it at 8 UK universities, actually, with students at 8 different higher education institutions. We actually ran a pre-trial of 100 students, and then we did a larger one with 800. So we tried this on nearly 1,000 people. And we were able to do things using, for example, machine learning algorithms we trained to extract perceived stress levels from wearable data, which were then, obviously with consent, which is the whole point of the platform, and agency of the, expressed by the users, brokered for micropayments on this platform. I just want to touch very briefly on anti-patterns for DLT. I think this is very important as well. DLT is not always a good idea, right? In fact, the main value of using DLT of blockchain is enabling data provenance when you have multiple independent parties. If you're ever in a situation where you have just a single organization use case, I go as far as to say DLT is always a bad idea. There are better scalable distributed database technologies you can use in DLT if you've got a single org use case. DLT is also high latency and often low throughput, particularly if you're using proof of work. It's not sustainable. And you'll see that most DLT patterns are proof of authority with these federated writer models rather than full decentralized writer models. And even then, we're talking about 1 to 10K writes per second, which may not be enough for global infrastructure you're thinking of building. So you need to bear in mind those limitations of current DLT technology. And I think I already stressed the point about putting personal information on DLT, even if encrypted. Ultimately, encryption will be broken. And you also have this problem of not being able to delete anything you put on a blockchain. So, in terms of right to be forgotten, you don't really get to be forgotten if you put personal information on the blockchain. So this idea of storing hashes to underwrite the integrity of data held elsewhere is a more common design pattern. Briefly, it's always worth considering governance. When you implement DLT, you should always think about the socio-technical context. In the case of proof of work, the governance model is that basically you're trusting no one in the consortium, in other words, everyone operating on the chain, controls more than 50% of the compute power. That may not be a valid assumption. I mean, if you look at Bitcoin, actually 65% of the compute power rests with just 10 mining pools largely run out of China. At least that was the case last year. I don't have the statistic for this year. If you go for proof of authority, which arguably is a more sustainable and scalable solution, then you're trusting that no more than 50% of the sealing nodes will collude on the data. And although we implemented this technology in Ethereum, which has this 50% rule, there are more flexible technologies out there, particularly Hyperledger Fabric is a good one to look at, where you can actually set this consensus rule to something other than 50%. You can put arbitrary governance policies in place. Is probably something you want to consider looking at when you design your chain solution. So final slide, I'm afraid. In conclusion, a common usage pattern for DLT is basically underwriting the integrity or provenance of data, but not storing data at scale, largely due to the scalability challenges, GDPR if it's personal data, security challenges with the encryption being broken long term. This is the pattern we subscribe to with Come Here. Come Here was one example of a decentralized platform for the data economy. Basically, it's an idea a little bit similar to the Open Data Institute's data trust, the idea that you can commodify your data and entrust it to someone, or in this case, a platform, in order to commodify it. Once data has provenance, it has the potential for value. And then it was this brokering system that then released that value through data fluidity, right, through the ability to share that data. The open challenges, I would say, that are unaddressed even now were things like implementing micropayments at scale. How do you do that with a low transaction cost? Maybe Lightning, maybe some other technologies that are emerging. And ultimately, I think this is fundamental to every DLT use case, thinking about how you ground digital identity. How do you ground this digital identity to a physical person? At the moment, society only accepts one way of doing that, which is centralized, which is basically government ID. Okay, but there are self-sovereign ID schemes that are emerging. Unfortunately, they're not mainstream, but maybe that's a longer-term solution. Okay, I'm sorry I went a little bit over, but I'm happy to take questions via email. Thank you.
Thanks very much, John. Caroline, can I hand over to you?
Yeah, thanks very much. And thanks for a fascinating presentation, John. So just looking at the chat, there's one question that seems to frame a couple of issues. So a question really to the panel, maybe it's most relevant to Jeff and John, is that does blockchain actually facilitate the sharing of data across national boundaries and overcome any of the boundaries of data protection laws? Or are these boundaries to the use of blockchain? So any opinion on that would be great. John, would you like to go first?
Well, I think the data protection laws, particularly around personal data, are certainly something that weigh heavy on the design choices you make with a distributed ledger. As I say, certainly weigh heavy on our decisions to store any hashes of data rather than data itself on the chain. But I don't think that was the only limiting factor that forced that design choice. There were issues of scalability and long-term security, even of encrypted data, that I think would make that a challenging choice to store personal data on chain. Certainly, DLT is distributed and therefore a way of distributing data. But I mean, if that is the single problem you want to solve, distributing across national borders, then I think there are more scalable solutions to achieve that aim. I think DLT's main value is in underwriting the provenance and integrity of data rather than as a data distribution technology itself.
Great, thanks. Did you have any views on that, Jeff?
I tend to agree with John. You know, these are very careful considerations that you need to make with any IT implementation, to be honest. It's not necessarily limited to blockchain. None of us really know what's down the line with data privacy and regulations that are coming up. I suppose the only thing that I can say with any guarantee is that it's a moving target at the minute. I don't know if any of you have followed what's happened recently with data protection in the EU, but basically one of the protections that IT companies had within GDPR has been blown to bits since the summer, and there are still some elements of GDPR which are holding it all together. The question is for how long? We don't know. It's tricky. One thing that's particularly relevant to blockchain, what John said, is to summarize it another way: be careful what you put in a blockchain. It's as simple as that. Be careful, because when it's in, and you're going to have real trouble getting that back out again. So those are considerations you need to make. Just from the top of my head, just very, very quickly, I think alongside blockchain, and maybe differently to blockchain, what does hold some promise in the future for these kind of scenarios is more the idea of distributed cloud, where we can take cloud and we can split it up into little more geographically aligned blobs.
Great, thanks a lot. I think the one other question again that sort of relates to that is that there's a bit of chat about whether blockchain can actually solve data management problems, or whether actually you have to solve your data management problem separately before you can implement a blockchain. So do you have any views on that, Jeff and John? And maybe Andrew, you might have a view as well.
It's a good question, I suppose. Again, in summary, there are good ways and bad ways of approaching anything in IT, and that includes blockchain. So having your data management strategy well defined, well understood, really in order before you approach something like blockchain seems to me to be a good sort of prerequisite anyway, and that holds true for any IT system. But again, I would come back to the extra added dimension with blockchain. Once you've got information in there, it's hard to get it out, so it's a lot more permanent. It's a lot less flexible in that way. So you really, really, really need to think it through.
Great, thanks. And John, did you have a view on that, on data management?
Well, yes, I mean, fundamentally, blockchain DLT is append-only data structure. You can only add data to it, and you can never take data out of it, delete or change it. That's its unique property, and its unique property is being able to do that without recourse to a centralized authority. So there are only certain use cases that are going to work. That's going to work for, okay, which you need to consider, I guess, as part of data management. The other main thing to think about with DLT is, I mean, the DLT is a mechanism for creating a distributed, trusted data store from, as a collaboration between multiple independent entities that do not necessarily trust one another. So it's a way of enabling multiple untrusting entities to create a trusted data store. That's its unique thing. So if that's what you want to do, if you have multiple organizations or multiple entities in a supply chain, for example, and you want to create an authoritative shared data store that's append only, like some sort of audit log, that's great. I can see it's going to work for that, modular scalability issues that you need to solve for your use case. But there will be many use cases where you don't need that, because all of your units are, for example, subordinate to one larger organization, in which case you would be better off using just, some sort of replicating distributed database.
Great, thanks. I think we're running out of time, so back to you, Chris, to wrap up.
Thanks very much, Caroline. Okay, so if you know an SME, And we're not just talking about startups. You know, SMEs can be pretty big and can have very successful product services, healthy cash flow, large teams, plenty to get their teeth into with a new product opportunity, or they might be a relatively new startup. But don't just think in terms of the youngest startups you know. Anyway, if you have SMEs in your network who you think will benefit from the kind of discussion that we've just hosted today and much more, then please put them in touch with us. There's an application form, there's a bit of bureaucracy to go through, but it's not too onerous, and quickly you'll be on the programme if you qualify. Please do contact us at collaborate@surrey.ac.uk. My colleague Amelia will pick up that message, whether that's a recommendation for us to follow up on, or whether that's a direct contact with a request to apply. Or you can visit the website, which is here, and you can apply directly on the website. These contact information will be sent to you along with the rest of the slides following this meeting, especially if you ask Amelia to send you that email. So really, it just remains for me to say thank you very much indeed to Andrew, to Jeff, and to John for not only presenting so clearly all of this information from different perspectives on blockchain technology, but taking time ahead of this meeting to spend quite a lot of time preparing, rehearsing, and coordinating these presentations, so that hopefully we've been able to give you a sense of the journey that an SME can go through in collaboration with solution developers and academic researchers. So thanks to you. Thanks to all of you in the audience. Those of you who've made it all the way to the end. I think there's 35, 36 of us still online. That's fantastic. What a crowd. That's great. Thank you all for spending your time with us this afternoon. And please do see this as the starting point of a collaboration, developing our network, our ecosystem of partner organizations to carry on into 2021 with all this support.